Gingiva is the gum. Space between is the vestibule. The labial frenulum is this piece of skin that attaches the lip to the gum. And we open it up, rotate his tongue. Hard palate, soft palate. The stretched piece right here is the palatoglossal arch. So that's the end of the oral cavity. So this is the oral pharynx that's opened right here. Nasal pharynx underneath it. Laryngopharynx that's open right here. The palatine tonsils. The lingual tonsils, also the root of the tongue, the body of the tongue, the apex of the tongue. The lingual frenulum, connecting it to the floor of the mouth. You have the filiform papillae, the little tiny white dots are the fungiform papillae. The ones on the side are the foliate papillae. And then in a V in the back, which I don't see this guy has any, so like there's a big round circle, there should be a circle around it, look like a target, that'd be the circumvallate papillae, or just simply vallate teeth. Incisors, canine, premolars, and molars. Let's see, am I missing anything? Come down here, the larynx. With its thyroid cartilage out front. The cricoid is the next piece of cartilage that's underneath that muscle right there. See how it's a little ring? And there's the thyroid gland right there. Backside shows some little white spots, which this one has. I can't get my finger out of the way. That white spot right there is a parathyroid. Open up the larynx, the big white lump. This is going to be hard for you to see. See, there's like this big one down here. That's the true vocal cord. That little flap of skin out in front is the false vocal cord. That's the epiglottis. Salivary glands we have underneath the ear, the parotid gland, the submandibular gland. These are lymph nodes right here. And on the other side, I've opened it up so that I can see underneath that where that vein is. And you'll see what looks like a white duct right here. I'm going to try to lift it. That duct right there that's coming down. That's coming from the submandibular gland. There's a little gland attached to it, a little triangular one. That's the sublingual. Trachea, esophagus, thymus gland. The vagus nerve right there, that white piece. It's right there. Okay, vagus nerve. And then the pericardial sac. The pericardial cavity is where the probe is. This whole space in between that's enfolded like by this mesentery is the mediastinum. And we have the left side of the lung, superior, middle, and inferior. Right side, superior, middle, inferior, and accessory lobe, which sits at the center. It's also called the mediastinal lobe. The diaphragm. The phrenic nerve, which is this thing right here. Goes over the root of the lung. See how it's pulling on the diaphragm? Diaphragm. And then you have the falciform ligament. Thickening on its edge is the round ligament. The liver, the falciform separates into right or left. So that's the left lateral, left medial lobe. The right medial lobe, which includes the quadrate lobe right here. And come over the side, right lateral, and caudate lobe. And the caudate lobe you can see again sticking up right there. It's L-shaped. The stomach, with the greater omentum attached to the greater curvature. Greater curvature is this, lesser curvature is right here, and this is the lesser omentum. All that right there. Fundus is the hump, the cardiac portion where the esophagus attaches. The body of the stomach, the pyloric antrum or area, narrows down right here to find the pyloric valve. This is now the duodenum swinging around. That's the C shape right here on the back body wall. That's the mesoduodenum. This is the dorsal lobe of the pancreas. And there's the ventral lobe of the pancreas, going over towards the spleen. That makes this part of the greater omentum the gastrosplenic ligament. Hold up the intestine, small intestine, that's all the mesentery. And again, as soon as we go around the horn here, there's the duodenum. As soon as it swings again, now it's the jejunum. And then I'm going to find the large intestine, which is right here. Okay. It's all this that's in my fingers right now. So the piece of the small intestine that comes in is the ileum. This little pouch right there is the cecum. That's where the appendix should hang off if this were a human. Ascending, transverse, descending, sigmoid, and rectum going down. That's all colon. The mesocolon attaches the descending colon to the back body wall. The urinary bladder, with its two lateral or umbilical ligaments on the side, they're filled with fat. The one in the center right here, sticking up, that's the median ligament. And I don't know which side we want to do here. Because that was more exposed. This is the kidney right there. See this perirenal fat. There's the ureter. And over here you can probably see the adrenal gland better. That little peanut right there. Underneath that vein. That thing moving around, that's the adrenal gland. And in case you have the parietal peritoneum on the back body wall, the visceral peritoneum on every organ, just like we have the parietal flora on the ribs, the visceral flora on the lungs,